If you have kids, it's best to be prepared for anything. So we're here to show us the must-haves for your medicine cabinet. We welcome the author of Doing It All, Stop Overfunctioning and Become the Mom and Person You're Meant to Be, pediatrician Dr. Whitney Casares. Thanks for joining us this Valentine's Day.
Absolutely. Happy Valentine's.
We're showing our love for our little ones.
That's right.
By being fully stocked at home.
Yes.
When you're in crisis, sometimes it's midnight, there's no store open, and you need something on hand. So you have the basics to prepare us for everything.
Yes, and really, these are the things you need. There's a lot of gimmicks out there, a lot of stuff people try to sell you. This is what you need. So I'm going to start first with thermometers.
Yes.
Lots of different thermometers out there on the market. The digital rectal thermometer is the one to use for your infant babies.
Little babies.
Yes, little ones. But once your kids can get old enough to squirm, they're not going to tolerate that. And so this is the one that I recommend in my practice. It's the ear thermometer, and it has the little cap that can come off so it can stay sterile.
Cool.
The reason that I like it is it's not going to have the user error that comes with using the forehead one all the time.
I experience that at home often. I think I need to upgrade.
Yeah, exactly. And then also, it's not going to have as many of the environmental changes that are going to potentially affect how accurate it is.
That makes sense.
So this one is the best one to use. I use this even for myself now, and they last for a really long time.
Oh,
so,
nice.
Yep.
Okay.
So that's
those
what I
are
use
super quick, right?
Super quick, like 2 seconds, 3
Beautiful.
seconds. Super easy. Next up is, and having a thermometer, let me say this, is really important because when you come in to the pediatrician office and you're like, my child had a fever. Like, well, what exactly was the temperature?
Yeah.
So 100.4 or higher for any person out there in the world is considered a fever by medical standards. So knowing what it is really helpful for us. This piece of data.
Perfect.
This is Pedialyte, and really what we're doing here is trying to keep our kids hydrated, especially when they have gastrointestinal diseases. So if a child is having vomiting or having diarrhea, or if they have a respiratory illness like a cough or cold and they're not eating or drinking very much, I actually don't care very much about the eating part when kids are sick. I just care that they're getting sugar, salt, and liquid into their body.
And that's all in there.
Exactly, that's all in here. Now, they sell Pedialyte popsicles and other brands of popsicles.
My kids are fans of those. And it's a great way to get them to actually eat it. You know they're actually going to use it because it's a treat.
Yes, exactly. And my kids would refuse this, but take the popsicles each and every time.
Yes.
Make sure your kids are old enough to not choke on popsicles if you're going to give that. The other thing you can use is a syringe for the Pedialyte. So even my older kids, sometimes if they were just watching TV when they were little babies or like toddler age, I would just like put it in the corner of their mouth and give them the Pedialyte that way.
Hey, whatever it takes.
Whatever it takes.
All right.
This is nasal saline mist, and there's a difference between nasal saline mist and the nasal saline liquid. So they sell it in a mist form, which creates kind of a spray like this.
Ooh.
Yes.
Nice.
But they also sell it in liquid. When you have the liquid, it's like waterboarding your child.
Oh, that sounds miserable.
Because it's just like shooting right into the back.
No one's having a good time.
No one wants that, right? So use the nasal saline mist. What it does is melt the snot and make it so that then that snot's gonna not get caught up in the back of the ears or get down into the lungs quite as easily.
Because once it's there, it's so hard to shake that, and then you've got the cough and the yuckiness for another week or so.
Exactly. And then again, age dependent, most people will allow you to do the little nasal saline mist. Also, if your child is young enough and you can wrangle them, using a bulb syringe to try to suck out some of that snot
still works too.
Yes. But if not, and if they're old enough, you can do little snot rockets in the shower. That works to get the snot out.
Yeah, and that crazy snot sucker contraption, it's disgusting, but it works.
It does.
And maybe if you have a designated parent to do it, like I would do poop, but I wouldn't do snot, so my husband could do the nose sucker, and that's a happy marriage right there.
Me too. I can't even change the cat litter box, much less suck snot out of my
Everybody's got to do one gross chore, taking care of everybody at home.
Yes. This is a humidifier, and there are a couple types of humidifiers. There's a cool mist humidifier, which is this one, and warm mist. Warm mist humidifiers, they'll work in like a very, very small closet, but in order to make it work with your child, you would have to get it so close to your child's bed, it might burn them. So if you're gonna have it next to the kid's bed, I like the cool mist humidifier. Again, the point is to just melt kind of that snot that's there. or in cases of croup, it actually kind of reduces inflammation in the throat area.
Nice.
Yeah. If you need to use a warm mist humidifier, I think it's actually easier just to put your kid in a steamy bathroom.
Right.
That makes it so much easier.
Gets the job done.
Yeah, exactly.
Okay.
Yep. Okay, next up is for fevers or for pain, ibuprofen and Tylenol.
Okay.
I brought liquid and also the chewable tablets.
Oh, yeah.
Yeah. Elementary school kids who can't swallow pills yet, go for the chew tabs.
Oh, nice.
So much easier
Why
for
not?
them.
Yeah.
Yeah, and a lot of times it comes in like grape or bubblegum flavor.
Yes.
Not too bad. You want to make sure you check with your pediatrician. Most of us have little forms or packets that we give patients about dosing. So make sure you have the correct dose. One thing for the liquid to make sure that the dose is correct is I like to use a syringe for that too.
Yeah.
This one came with a syringe, but if you don't have a syringe that comes with it, you can always ask at the pharmacy.
Oh, nice.
They'll give you free syringes to go with the medication. Ibuprofen you can't use for kids under the age of 6 months old.
Okay.
But for kids over 6 months old, either Tylenol or ibuprofen works. My rule of thumb is ibuprofen usually works better on fevers than on pain, but Tylenol is easier on tummies.
Okay.
So when you're choosing, I would think about, is my child having an issue where they're vomiting all over the place? Ibuprofen is not my go-to, Tylenol is. But if they're in severe pain or having a high fever, I would use ibuprofen.
And just keep that chart. Ours is just on the fridge so we can see it every time and know what the dosage is for whatever age or size your kids are.
Yeah, and it's based off of weight.
Yes.
So that's how we calculate it.
Okay.
All right, this one is a commercial brand of honey.
Oh.
So for children, we actually don't recommend cough syrups. However, there are some brands who have commercialized just having honey in here. Like this one has honey, water, natural flavor, and some citric acid. So that means like lemon or orange in it, right? So perfectly fine if you want to purchase it this way. If your kids are old enough to just swallow a teaspoon of honey or a tablespoon of honey, that works too.
It does the trick.
Totally. It is proven in studies to be just as effective as the cough medications.
Without all the other ingredients in there.
Exactly.
Why not?
Yep. And special thing about honey, no kids under the age of 1 year of old.
Oh, okay.
1 year of age should be using honey.
Okay.
Yeah,
That's
for
a good rule.
botulism risk.
Yes. Okay.
Yep. And then finally, this one's not related to coughs and colds, but I just wanted to put a plug in here for good old hydrogen peroxide.
Yes.
Yes. So this one's good for cuts or scrapes if the kids are old enough to do like swishing and spitting if they have like a little cold sore or ouchie in their mouth. It can help to sterilize and then also to just wash away the debris.
Yes.
We always say when there's a cut or scrape that dilution is the answer to pollution.
Oh, okay.
So you're trying to just physically wash out that gunk that's in there so that the skin will not become infected.
I have a very old bottle in my bathroom that I will be replacing now because I'm sure it's expired.
Yeah, absolutely.
Great stuff. Thank you so much. Great to see you.
Absolutely. Great to see you
Have
too.
a lovely Valentine's Day.
You too.
We'll have more information on our website at katu.com, and we'll be right back with more Afternoon Live right after this.